Hi, I'm Dr. Shuen, a board-certified genetics doctor who helps people live longer and healthier. And the most important thing I tell my patients is to watch what they eat, because your diet has such a huge role on your health, your longevity, and even your day-to-day mood and energy levels. So it's important to choose a diet that's right for you. Everyone's different, everyone has unique genetic profiles, and this influences the types of foods that you can metabolize and consume. So with all these different diets popping up, like the keto diet, the baby food diet, and even the Liver King diet, I just want to bring some clarity and some evidence-based medicine into the discussion so that you could choose the right diet for yourself.
All right, so the first on the list is the baby food diet. Yeah, it's literally just baby food, like food for toddlers. This diet was made popular by Jennifer Aniston and Gwyneth Paltrow in the 2010s, and they did it to help them stay slim, lose weight possibly. It's basically replacing 1 to 2 adult meals with small jars of baby food, like pureed fruits and vegetables, sometimes a little bit of meat. As you can see here, you're breaking down fibers in the puree, and you're just gonna get a lot of that sugar rush when you eat something like this, because there's nothing slowing down the absorption of the sugar. So that's one reason not to do this type of diet. You're also not getting a variety of vegetables, although you could, I guess, put different types of vegetables and just puree everything. But typically you're just eating 1 to 2 different types of vegetables, and it's just not going to give you that sort of diversity you need to keep a healthy microbiome. So yeah, don't try this diet. If you want to lose weight, there's other ways to do it. I give this a final rating of a C. Next, we have the Mediterranean diet, which is one of my favorite diets. It was inspired by the traditional cuisines of the Mediterranean Sea. And if you go to Italy or Greece, where the diet is based, they live extremely long and healthy. 2 blue zones are in this region. So Sardinia of Italy, and what they consume is just tons of vegetables, fruits, whole grains, a lot of legumes, extra virgin olive oil, nuts and seeds. As you can see here, some fish and seafood, which is rich in omega-3s, and just a lot of antioxidants from herbs and spices. So you can see here just a variety of color that you see, some figs, a little bit of bread. They should be whole grain bread. Don't need anything that's high in gluten. Try to go for sourdough if you can. Tomato paste, which is high in lycopene. You have basil, a lot of spices, and olives, which is high in polyphenols. Then you have walnuts here, and this is extremely healthy for your brain because walnuts contain a precursor to omega-3, which is alpha-linoleic acid. It also contains a precursor to urolithin A, which is extremely healthy for your mitochondria, the powerhouses of your cells. So urolithin A is the active form, but what walnuts have is something called ellagic acid. It's also found in pomegranate seeds. And then here we have strawberries, raspberries, blueberries, just full of fisetin, a lot of polyphenols as well, and antioxidants. Blueberries contain anthocyanins, which prevents dementia. So this is extremely healthy for your heart, your brain, and lowers your diabetes risk. And there's just tons of evidence backing this up in terms of population studies as well as animal studies too. If you had ApoE4 or high risk of heart attacks because of hypercholesterolemia or elevated lipoprotein A levels, this is the type of diet I would recommend you try, because there's just so much heart and brain cognitive benefits with this type of diet. The other thing they eat is a little bit of dark chocolate. So dark chocolate contains flavonols, epicatechins, and catechins, but you should definitely make sure that when you buy dark chocolate that it's at least 80% dark and that it's been tested for heavy metals like arsenic and cadmium, because that could really impact your longevity if you eat too much, because heavy metals are very toxic to your health. Right, so that's the Mediterranean diet, and I give it a final rating of S. All right, so next is the keto diet. Keto diet is first used in medicine to help people with seizures. So it can lower the number of seizures they have. It stabilizes the neurons so that the neuron doesn't fire so much. And and well, where they can't metabolize carbohydrates, so they're using ketogenic diets. But for the everyday person, a ketogenic diet is helpful in terms of converting to carbohydrate metabolism into fat burning metabolism. And once you're able to burn fat well, you're able to do prolonged fasts very easily because you have the fat stores on your body that you could easily tap into. People who aren't used to burning fat can't tap into the fat that they have stored on them, and they feel very weak and tired when they switch to a ketosis and try to do prolonged fasts. So doing a ketogenic diet could be kind of like an intermediary step towards going from a carbohydrate diet to prolonged fast and trying to lose some weight. But there's a healthy and unhealthy way of doing ketogenic diet. The unhealthy way is just eating bacon, cheese, and eggs all the time. The only good fat here I see is this avocado. There's just very minimal levels of fiber and starches, which is what you expect. So what you should try to do instead of eating bacon and cheese is to replace these fats with healthy fats like nuts, seeds, olive oil, and then increase a little bit more the fiber intake because you do need some fiber for your microbiome. Other things you could eat would be like salmon, fatty fish, mackerel. These contain a lot of omega-3 fatty acids, which is extremely healthy. So instead of those, like a bacon, you should switch it out for something healthy like salmon, mackerel. And these are really rich in nutrients. So that's what I would say about the ketogenic diet. It's just try to avoid eating too much saturated fat because that will increase your cholesterol and increase the risk for developing clots in the arteries, atherosclerosis, and heart disease. All right. So if you have a medical condition where you need to be on a ketogenic diet, of course, this is going to be an A-tier diet for you. But for most people, it's pretty unhealthy, I would say. So yeah, a D-level diet. The next one would be Ozempic, and that is a diet that was inspired by the drug Ozempic, which is used to help lower your appetite and help you with weight loss. It's a medication you inject, and every 1 to 2 weeks, I guess, and it'll completely stop you from eating. Most people eat just one meal a day on this type of medicine. But Ozempic is basically eating just oats and rice with water and lime juice. Might have some fruits in it, I guess, but you're just eating oats all day to help you lose weight. And of course, this is not nutritionally balanced. There's no antioxidants. You don't have any minerals, vitamins. The oats do have some benefit, but if you're eating only oats, you're just going to lack a lot of other things. So oats have beta glucans, which are soluble fibers, which can help lower cholesterol levels, like your LDL bad cholesterol. It contains some antioxidants, which will help lower your blood pressure and inflammation, but that's pretty much it. You're not getting much else. And in fact, you have things like phytic acid in oats, which will prevent the absorption of zinc, iron, and calcium. So just beware. You could incorporate a little bit of oats into your diet, but it shouldn't be all you're eating. One other thing is that oats, while they don't naturally contain gluten, because most oats are processed in a facility that contains wheat, rye, and other containing food, you're going to get some cross-contamination when you buy oats. So people with celiac disease or people sensitive to gluten should try to avoid them. Oats contain something similar to gluten, and it's actually called avenin. So avenin is similar enough to gluten that in some people with celiac disease, it can result in some sensitivity. So even celiac patient might need to avoid gluten-free oats. At Ozempic diet, I would give it a final rating of an F tier. All right, so the next one I have is the DASH diet, and it stands for Dietary Approaches to Stopping Hypertension. So this diet is designed to lower your blood pressure. And lowering your blood pressure is extremely good for your longevity because high blood pressure will cause dementia, heart disease, and kidney failure because there's so much pressure going into these very fine, delicate blood vessels that they will just become very stiff over time. And how it does this is basically incorporating some of the elements of the Mediterranean diet with lots of fruits, vegetables, a little bit of meat. But what they're limiting is your sodium intake. You're reducing your sodium because sodium will increase your blood pressure, and it increases your potassium by increasing the amount of vegetables you're eating. So you typically want like 1,500 to 2,000 milligrams of sodium and like 4,500 milligrams of potassium. So that's what you're aiming for, and it's all from your diet. You could also supplement if you're not getting enough potassium with a little bit of potassium citrate. That can help because if you're not eating a lot of vegetables, it's very difficult to get that much potassium in your diet. And if we look at the DASH diet here, you could see there's like a lot of vegetables, alfalfa sprouts, tomatoes, avocado, quinoa, and olive oil. So just and a little bit of meat, some chicken. That's, I guess, what would be considered a DASH diet. There's just a lot of vegetables and not so much protein. Now, it'll help you reduce your blood pressure, like I said, but also certain cancers and improve your bone density as well. People with salt sensitivity should probably consider this diet, and you can do genetic testing to find out if you're sensitive or not, but it mostly applies to people from Southeast Asia, like Hong Kong, that region. There's a lot of people who are salt sensitive, including myself. People with African descent also should pay attention because they have a risk of chronic kidney failure. And Indians as well. There's anyone with a family history of hypertension should really follow a low sodium diet. All right, so the DASH diet is something I would recommend to anyone with risk of hypertension, and I would classify it as an A tier. Next, we have the mukbanger diet, and this is just, I can't believe people doing this type of diet. It's just insane to me when I first saw. That's just basically you're eating processed food and fried foods. Look at this guy. He's eating like 50 chicken McNuggets, McDonald's, ramen. Now, too much food in a very short amount of time. So you basically ate everything in under 10 minutes. And the ramen here is going to give you a huge sugar spike. I tried it myself with a continuous glucose monitor on, and it went to like 11 when I'm usually at a 6. Fried foods is of course bad because it's full of oxidized lipids and will age you very, very quickly. So try to avoid this diet at all costs. I just don't understand how they have 33.1 million subscribers doing diets like this, and then this video itself got 71 million views. So please don't follow this diet, and please listen to me and subscribe and try to follow a healthy lifestyle so that you could be productive and healthy throughout your life. All right, so I'm gonna give this like an F- rating, just the worst of the worst. Next, we have the carnivore diet. The carnivore diet is very restrictive. You're eating just meat, eggs, fish. It just completely lacks any vegetables and fruit. You're not eating any grains, legumes, nuts, seeds. It's just going to be extremely low in antioxidants and like vitamin C, folic acid. You're not getting any of those nutrients. So actually there's some people who have developed scurvy just eating carnivore diet. Like I'll show you. Yeah, so James Blunt developed scurvy after trying an all-meat diet. And then there's like a case report where this gentleman here who's 54 years old was just eating only Bunker Hill canned beef and other cooked foods with very minimal fresh fruits and vegetables. And he developed like hemorrhagic gingivitis. He had hyperpigmentation and scarring of his bone biopsy in his leg, I guess. You could see his leg here as well, developing purpura, which is like a type of bleeding, and petechiae here on his leg. So when this happens, this is like very severe scurvy, and you're just not getting a lot of vitamin C. And I was just looking at some of the research done on even traditional populations or populations who have a traditional diet of only meat, like the Inuit up north. And they looked at their vitamin C levels, and while they're not deficient, a lot of the vitamin C is actually coming from the algae that they're consuming and not from the meat. So they avoid scurvy by having their requirements met by the algae and not from the meat that they're eating. And the amount of vitamin C that they ate wasn't a lot. They were just getting 79 milligrams per day or 59 milligrams per day for females. And what I recommend most people take is about 250 twice a day, and that will protect your arteries from atherosclerosis, keep them healthy. And myself, I have like a vascular age of -8 years, and I've been following a healthy diet. So try at least, if you do a carnivore diet, make sure you're getting some supplements like vitamin C and B, folic acid, which is vitamin B9. So at least supplement with folic acid if you do a carnivore diet. I know it's very popular with people like Michaela Peterson and Jordan Peterson, who really develop serious allergies almost to vegetables and can only eat meat, it seems. But when you eat only meat, in addition to not having all these antioxidants and vitamins like vitamin C and B9, you're lacking fiber, which is good for the microbiome in the gut, and you're increasing a lot of saturated fats and cholesterol in your bloodstream. So you're at risk for developing heart attacks later in life. And then, of course, if you're cooking meat with grilling and frying, you're going to increase a lot of polycyclic aromatic hydrocarbons, which are carcinogenic, and this could increase your risk for colon cancer and other cancers. So while you're not eating a lot of carbs and reducing your risk for diabetes, you're going to increase your risk for other things by going on this diet. And I'm just so surprised that it's catching on with the world. All right, so this diet, I would give a final rating of, I would say like a B or C. For some people, it might be healthy, but most people shouldn't go on this diet. All right, and then next we have to talk about the Liver King diet, which is, I guess, a subcategory of the carnivore diet. It's made popular by this guy named Brian Johnson, not to be confused with the billionaire and health fanatic Brian Johnson with a Y. So this guy here, let's see, Liver King diet, he's super masculine, but actually he was caught using testosterone to become this so muscular. It's not just from the meat that he's eating. And the meat he does eat is just all red meat, and he's eating like raw liver, raw eggs, raw fish. This type of diet will definitely age you very quickly because you're eating a lot of iron, and iron is very oxidative. So the people can actually develop something called hemochromatosis, where they have an iron overload. And if you're eating too much iron, this is going to cause you to have arthritis. You're going to get a heart disease called cardiomyopathy. You can even get diabetes as well. So we have to be very, very careful with the amount of iron you're consuming, especially people with a genetic condition that leads to iron overload, and it's called familial hemochromatosis. They can develop serious liver failure as well. All right, so one last thing is the vitamin A in liver is extremely high. There's about 30,000 international units in just 100 grams of cooked liver, and we only need about 3,000 units for men and 2,300 for women. So just eating 100 grams of liver is going to give you 10 times the amount of vitamin A that you actually need. Too much vitamin A will lead to toxicity, and it's similar to the drug Accutane. You could get cracked lips, very dry skin, hair loss, brittle nails, and bone pain, and even fractures if it's done long enough, and even liver failure. You can also develop headaches and fatigue and depression. So definitely try to stay away from eating too much vitamin A. And if you're pregnant, definitely watch how much vitamin A you're going to take, because this can lead to, vitamin A is a teratogen and can lead to fetal malformations. All right. So this diet is also an F. Next, we have the Okinawa diet. Okinawan diet is, of course, a longevity diet because Okinawa is a blue zone where they just have the highest proportion of centenarians in the world. And in the 1970s, when the Okinawans were practicing this diet, women lived to 84 and men lived to 78, which was at that time one of the highest in the world. But because of Western influence, a lot of the Okinawans kind of lost their traditional diet and started eating more westernized food, which contained a lot of fried foods, rice. But if you ate what the traditional Okinawans ate, it consisted a lot of, you could see here, like just you have miso soup, which is very healthy. It's fermented soy. Then you have purple yam, which has lots of anthocyanins, which is an antioxidant. You have a lot of other carbs, so it's quite carb heavy. So you have potatoes here. You have vegetables which were pickled, like carrots, radishes, cucumbers. And here you have bitter melon, which is a staple in Okinawan diet. It helps lower blood sugars. Here's the only thing I would disagree with eating, which is the tempura batter with, I guess it's like pumpkin or some sort of vegetable. It's just anything fried food is going to eat you, but I guess that's not a lot. And then here you have spinach, and then I think this is fermented, some kind of fermented tofu maybe. And here you have just normal tofu and gooseberry, which is fruit. The only meat they eat is just a little bit of meat. They can have like seafood here usually, but in this case it's pork belly, and it looks also kind of stir-fried as well, which is I wouldn't eat anything stir-fried either. So yeah, this is like their diet. It's just full of antioxidants, a lot of vegetables, very little meat, very high in carbs actually. So people who have perhaps inability to process fat could do well on this diet. It's very low in saturated fats, so it could be good for people with ApoE4 mutations, which like increase their cholesterol and lipids and increase their risk for Alzheimer's. So an Okinawan diet could help protect their cognitive function and heart health. I give this diet a final rating of an S. And for myself personally, I like to incorporate just like the best of both worlds from the Mediterranean and the Okinawan diet. I just pick what I think will benefit my health the most. And it shows in my stats. Perhaps next time I'll try to show you what I personally eat in a video. But I just wanted to talk a little bit about the different diets and give you guys a little background on what diet to choose, and based on your genetics and your personal lives, try to help you live a healthier and longer life. So if you like this video, watch this video where I dry fast for 7 days, or this video here, watch this video that YouTube thinks you'll love.